Peace and greetings to you. This is Dr. O, the PA Pro, otherwise known as Omar Abdul Malik. I just wanted to share some thoughts with you guys tonight. I think it's 12 a.m. It's now officially Wednesday, November 23rd, 2016. I just wanted to talk about, I think today's topic, I'll talk about the sanctity of life. I think in the past 4 weeks I've lost a few patients. They died. One died yesterday. And I ran the code. Was it yesterday? Might have been Sunday. I ran the code, and that's when you run a code, that's when you're standing at the head of the bed and you're giving orders, or the foot of the bed. You're giving orders to people, intubate the patient. Let's get IV access. If we don't have IV access, get intraosseous access. Give some epinephrine and some bicarb and keep doing chest compressions. If it's a shockable wave, you shock the person. But it's a very routine thing. So, a couple of days ago, like I said, I lost, a patient died. Had the nurse call the patient's family. And the patient's family came, and I offered my condolences and answered any questions that they had to the best of my ability. And then I went about the routine stuff, or the routine protocol of doing what we do when a person dies. You sign the code form, you have a post-code meeting, then you do dictation of the death summary. You sign a death certificate a day or two later. Call the maintenance guys to come clean up the room and maybe change the bed, and call ICU and tell them, hey, there's a bed available. If you want to move a patient from ICU, we got another bed here. But there's a very routine algorithm that I follow, and we in the healthcare profession follow when a patient dies. And it made me realize just how mundane the loss of life can become, especially when you're in this field, and especially for me as a hospitalist, working at a long-term acute care setting. Most of our patients live. I'd say 99% of them, but we have deaths. I mean, when you have patients with multiple morbidities, so respiratory failure, kidney failure, heart failure, encephalopathy, then they get septic, or they come to us septic. I mean, it's, the odds are never in these people's favor. So nature kind of takes its course despite our best efforts. But one of the things that I noticed about myself is that, the more exposed I am to death, the more routine it becomes. I think there's almost a callousness that develops, and it's not and like I don't care, but it's a thing of where you're like, okay, this person, they were old and sick, they were supposed to die. You don't want to get into a thing of sobbing with the family and taking on a lot of the heartbreak of the family. But at the same time, you or I don't want to ever become so indifferent to death. Life is precious. We just got out of a campaign here, presidential campaign, and there was a lot of talk of bombing people, and we're going to kill this group of people and go after their families and friends, and the people in this country should be bombed. And it seemed like every other month some young black man was getting shot, then the police were getting shot. It's death is part of the nature of life. But I think we as a society have started to take life for granted. We've lost this idea that life is very precious. I mean, a lot of work goes into trying to keep a person alive. This particular code that I ran lasted almost an hour. I mean, chest compressions and, just, we really tried. It was very physically and spiritually exhausting because, despite our best efforts, like I said, we wound up losing the patient. But it made me think about, just how much effort we put into saving lives and how easily lives are taken or lost. I did a video, I think, a couple of months ago about a young man that was killed in a motorcycle accident right in front of our hospital. Split second, instantaneous. And that's how our lives go. So I worry about us as a people and us as a society where we have, you look at our entertainment today, we extol violent movies. A guy jumps into a crowd of bad guys and he uses some kind of fancy karate and kills them all. And it's like, wow, that was really cool. Now look at Denzel do his thing, or Tom Cruise, or I think the Bourne Supremacy guy. That's really cool. I think something is awry with us, you could say spiritually and even psychologically, when you're looking at us as a collective, where you really extol the taking of life. Because I've spent my entire adult life learning how to nurture and be somebody who saves lives. And I don't want us, the collective us, I'm saying, to lose the idea of the preciousness of life. And I really encourage you all that are going into the healthcare field. I mean, guys like you, Kenyon Brown, the nursing student, Lou, the PA student. Keep doing what you're doing. You guys are embarking on an amazing path of trying to learn how to be healthcare providers. So we can help, save people's lives. Every life is precious. I've taken care of, people from, all walks of life, and, from the very young. Wasn't crazy about that. I was in a NICU. I don't think I'm cut out for a NICU, to the very old, and then those in between, like I do here. But I guess that was my take-home point, is that life is precious. Let us try to extol the virtue of trying to be life savers instead of life takers, and keep trying to do the best we can as people. Anyway, I'm rambling again, but if you have an interest in healthcare or a healthcare career, especially in medicine, please subscribe to my channel. I also cover fitness. I'm trying to lose weight and prepare for my 17th marathon, and I'm very bullish about scientific education. So if you have an interest in that, I'd encourage you to subscribe, tell your friends and family. Take care. Peace.